The agenda this week looked at whether Ontario can afford its proposed healthcare spending and why positivity isn't always a good thing. The agenda's week in review begins with the COVID-19 crisis in India.
Barca, first and foremost, our condolences on your loss. This must obviously be a horrible time for you and your family, and we're hoping that by sharing the story of your father's circumstances, we can help to tell India's story and have everybody learn a bit more about what's going on and the gravity of the crisis in India. Can we start just by having you tell us what did happen to your dad?
Thank you, Steve. And yes, I think one of the reasons that I do want to talk about my father is because in the telling of his story, I'm also telling the story of my country. Um, the irony, of course, is that as a journalist, I've been reporting nothing but the COVID pandemic for the last 15 months from across India. And to quite literally become the story that I had reported has been surreal and devastating and heartbreaking. My dad, like everybody else, started off with a mild infection, and the doctors thought he could be managed at home. And for 1 week, he seemed to be doing absolutely okay. In fact, I was out in the hinterland reporting the COVID crisis, even as my father had tested positive, because the doctors felt that it was manageable and I didn't need to worry. But after a week, his situation just nosedived. He had other comorbidities. He was diabetic. He was in his early 80s. By the way, he'd had one jab. The reason this is relevant is I'm haunted by questions about, the if and when of India's vaccine rollout. Had those vaccines rolled out quicker, had I managed to get him 2 jabs in time, maybe he'd still be alive today. But what happened was this, that when the doctors finally said, look, you've got to get him to hospital, the health system here has been overrun. It's been overstretched. Every resource is wanting, even for people with relative privilege and access to resources like me. So I organized a private ambulance thinking it would be quicker to rush him to hospital. And I made what I think is possibly a fatal error. What arrived was actually a rickety old car repurposed as an ambulance. It had no paramedics. It had a crew of one, which was the driver, and it had a single oxygen cylinder at the back. I panicked a bit at seeing this, and I asked the driver repeatedly, "Does your cylinder work?" And he assured me that it did. So because I was panicked and wanting to get my dad in time to the hospital, and the hospital ambulance would have taken another few hours because that's how overburdened the hospital was, I put my dad onto the back of the seat. There wasn't even a stretcher. I jumped onto the front seat and I rode with him, by the way, through traffic snarls. One of the big gaps in our cities is we still don't have a green corridor for ambulances. And by the time we reached hospital, unfortunately, the cylinder had not administered the high flow oxygen in the way that it should have. And his oxygen levels plummeted. He had to be taken straight into ICU and he never made it back. He lasted 5 days and 2 of those were on ventilator. What I want to say is, through all my heartbreak, through all the trauma of that ambulance, through the fact that I will be shadowed by guilt as to why I took that non-ambulance ambulance, my father had a fighting chance at living. He got excellent medical care when he finally got it. But most people I have been reporting on did not even get into the insides of hospitals. Or if they got into the insides of hospitals, they died not from COVID, but from oxygen supply running out to these hospitals because oxygen ran short. So I am aware in this moment of personal heartbreak, and it's a strange thing to say, that my father was luckier than most. He didn't make it alive, so he was deeply unlucky. But in having that chance at living, he had a chance that hundreds of thousands of Indians did not or have not been getting.
I'm really trying hard when I ask this question not to bring politics into it, but you can't help but notice that there are television commercials that have been taken out by the Ontario Progressive Conservative Party, Doug Ford's party, obviously, Premier Ford's party, urging Justin Trudeau, the Prime Minister, to tighten up the borders because he says, in his view, there are too many cases. Well, what's the line he used? COVID's it's not swimming over here by itself, is the line he uses. It comes on airplanes. Now, you're an infectious disease specialist. Do we have a problem with a porous border and, say, flights from India bringing COVID-19 to Canada, to Ontario at the moment?
Any kind of flight coming into Canada or any international flight allows viruses to spread. So it's not just flights coming into India, it's other parts of the world that have hotspots, but also flights often don't come directly from India. They come through Europe, or they might come through Africa. So unless you're willing to stop all international travel, which is what we should be doing, stopping all non-essential travel, it's hard to make a difference with just stopping flights to India. And most of the transmission occurring in Ontario is really people who are essential workers, people who are being exposed to COVID through the work that they're doing. And so we need to address that. We need to address unpaid, paid sick leave. Those are issues that, and in trying to keep sick people home, those are the issues that we need to address in Ontario. It's not so much the borders, but again, if we're closing, we should be closing all international flights, basically all non-essential flights from around the world, not specifically targeting India.
The reason that these cliches exist, like the whole, keep a stiff upper lip and always look on the bright side. And, coming from a British background, the whole stiff upper lip thing was deeply ingrained in my psychology. So it was always, you have to be strong, you have to be positive. And also that idea that just no one wants to be around someone who's negative all the time. And I didn't want to feel like people would think that I was complaining, because, no matter how bad it was, there's always someone who has it worse. So there's also that we're always constantly thinking about how we're being perceived by others. And I think that is also part of it.
I should ask you, how are you now anyway?
I'm doing great. Thank you.
Okay, good. Glad to hear. Peter, put us into a common scenario where, let's say a typical married couple, one of them is a very sort of normally chipper, upbeat person. The other person is, just kind of walks around with a cloud over their head all the time. You want to give some advice on how to handle that situation?
Yeah. In that kind of case where one person is more toxically positive and not listening to the other partner, that person who's more upset may be feeling invalidated and dismissed whenever communicating about negative things. So if that pattern continues, that person would feel more unheard and discouraged and may share less and less of those experiences over time. So the problem is that this can build up slowly over time in a relationship and lead to emotional detachment and serious conflict. So when people are noticing this happening, I think it's really important to improve the emotional communication, try to recognize when this is happening and try to listen better and really get into the other person's experience rather than trying to replace it with your own.
That's the key, eh, June? Listen more, talk less?
Absolutely. And to kind of follow up on that point, we found that people who have what we call high levels of dispositional positive emotion, people that tend to experience positivity across contexts, this may actually cause them trouble in relationships where a partner's sharing something negative with you. Imagine your partner has come home from work and had a stressful day or received some bad news about their health. We find that those who continue to have these high levels of positive emotion in those relationship contexts end up misunderstanding their partner. And that can pose obvious concerns for relationship satisfaction and the ability to really connect with others and support them.
Sydney, you researched this for your piece, obviously, for Chatelaine. How far back does this, what do you want to call it, positivity trap, how far back into history does this actually go?
It's funny, it's not a new phenomenon, that's for sure. And in one of my sources that I interviewed sort of compared to what we do now on Instagram to back in 18th century portraits. If you're walking through an art gallery, you can see a man with his dog and his kids and his wife, and everybody's beautifully dressed. And as I noted in my article, you don't see the outdoor plumbing and the smallpox scars. Like there's this whole idea of creating this fake persona, this artifice of positivity and affluence and happiness. If you go through any Instagram feed, you won't see people most of the time where it's very curated, and it's a whole sort of, there's a lot of artifice in this world that we create online for others to see. And I think that we do that ourselves as well, and it goes back for forever.
I don't necessarily want you to throw any of your family or relatives under the bus here, but I am going to ask this question anyway. I mean, you mentioned a few moments ago you got this sort of British stiff upper lip thing going on in your family. Did you have it out with any of your family members when you were going through what you were going through?
I just was being. I mean, I remember my mom always saying to me, "You're always so positive. You're always so upbeat about everything." And I even felt uh, hesitant to tell my mom, who I'm very close to, how I was feeling. And she's always been very strong growing up. Even when I didn't never knew when times were bad, even when they were bad, because she hid everything. And so I think that has sort of I've inherited that, and I never really had it out with anybody. I just found myself doing the same thing with my kids in my family.
It's just occurred to me we should have invited your mom to come on the show too and get her side of the story, just in case the daughter
She would have
isn't.
killed me.
Yeah, well, that's let's not have any of that. Okay, June, pick up the story from this angle. Social media, of course, has a profound impact on everything today, usually negative. I shouldn't say that, but it feels like it so much of the time. What has social media done to the topic we're discussing tonight?
I mean, I think social media is complex, right? Because as you said, there's a duality to it. There are ways that it, especially in times of physical separation, can give us some sense of being connected to others. But I think the dark side or downside of it when it comes to positivity is creating unrealistic standards for how we ought or should be feeling right now. People are posting images of smiling with their friends or their family, or going out and doing fun things, winning awards, humble bragging, all these sorts of things. And it creates what we call a kind of discord, because we're engaging in social comparison. And those social media images are setting up standards for how we think we should be feeling. And that's not always positive.
The diagnostic testing backlog now facing Ontario patients. And for those listening on podcast, I'll go into some detail here. If we go back to the beginning of the pandemic, that's March 2020, you can see on this chart there is very little backlog at all to speak of. But then as the pandemic takes root, the numbers really go up and up and up a lot. And today we're looking at a non-emergent diagnostic procedure backlog of 1.6 million procedures. And if the current rate continues, the FAO has got that estimated by September to be nearly 2.5 million backlogged procedures, which the FAO estimates could take 3.5 years at current spending rates to clear. That clearly is not acceptable, I would assume, to the people of Ontario. But Andre, let's just remind everybody what the FAO is talking about when they're referring to this kind of a backlog. The services that this would include, non-urgent diagnostic services, means what?
Well, mostly surgeries, so not urgent surgeries, but elective surgeries. So there have been, as the report says, millions of procedures delayed, put off, and we're going to have to catch up at some point. And the question is, how do we do it? We can't magically add doctors and nurses. Operating rooms were already full. We already had shortages of staffing. So this is a problem. And these numbers really underscore just how severe the problem is. But the solution is a lot less obvious.
And this chart actually is not even elective surgeries. This is just the diagnostic procedures, the biopsies and that kind of thing, which I mean, if you're somebody waiting for a diagnostic procedure right now, Andre, this can't give you a lot of comfort, I presume.
No, this is essentially, I should have stated that more clearly, the prep before the surgery. You have to be diagnosed, etc. So waiting for scans and things, no, it's a time where people are very worried. They don't know the results. They don't know what's going to happen. And this was a problem before COVID. We didn't have a big backlog, but it was sort of always trying to catch up. And it's just backlogged terribly. And again, it's not clear how the catching up will be done in any quick fashion.
Rosalie, could you give us your characterization of the significance of those numbers?
Certainly. Really, I think that the number of people waiting or tests that we haven't done sort of speaks for itself for the size. But what I'm more concerned about, and sort of echoing Andre, is that those numbers don't include the considerations for, do we have the capacity, do we have the staff to actually be able to deal with the backlog in the time that the FAO is projecting, because they're assuming that hospitals can operate above capacity for that entire period. And we're thinking about 3 years. So my worry is that all of that delayed diagnostics will actually mean that once we do get to diagnosis and people reach treatment, their case might be more complex, which could come with health consequences for the patients, but also increased costs for the healthcare system. And so I suppose, though that number is somewhat alarming as it is, my worry is actually that it might be too optimistic in terms of how quickly we'll be able to deal with the backlog, and that it might not include added costs because we've not found something during that backlog.
Well, that raises an interesting question because, okay, Sheila, Peter Weltman, the Financial Accountability Officer, in my interview with him just before you guys came on, said that essentially the province is going to have to double the current spending it currently budgets in order to clear that backlog. Rosalie raises the issue that even if they did that, do we have enough doctors? Do we have enough nurses? Do we have enough OR capacity? Do we have enough diagnostic tools to be able to do it anyway? What can you tell us on that?
Well, I think there are a number of ways in which we can start to address this. One of which is we have internationally educated healthcare providers that we could, fast track into service in this kind of situation. And we have to really take a hard look and see what capital expenditures would need to be made, what kinds of investments do we need to make in more healthcare providers. And I think we really have to look at what we have done during the pandemic and step up in the same kinds of ways that we stepped up then. And I really think that we have faced decades of underinvestment in healthcare in Ontario. And as a result, the chickens are coming home to roost here. And I think we really have to take a hard look at what we need in the healthcare system and how we're going to pay for it.
That's just some of what we covered this week on the agenda. For more, including the full conversations, you can visit our website, tvo.org, our YouTube channel at youtube.com/theagenda, or our Twitter feed, twitter.com/theagenda.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.